2 days ago, my father came home from hospital. As soon as the ambulance driver left, I made this video. Hello, my name's Chris Powis and my father's just arrived home. It's Friday the 6th of February 2009 and this is the way he's dressed. The people at Chase Farm Hospital, just one moment Dad, have failed to put any socks on my father. And just look the way they've dressed him. Jimmy, that's just a shirt thrown on but not tucked in. Hang on a moment, Dad. His hat looks like it's not really folded over correctly and looks like something out of a cartoon. And it's absolutely deplorable. They said that they couldn't find any socks. There's 2 pairs of socks in his case just here. And I took a second pair along last night. They're actually in here. Here they are. I've just opened this case and there are the socks. There's the socks there. So they've lied. And they're allowing an old age pensioner out, and just look at the weather conditions outside. It's snowing. It's ice and cold. This is absolutely deplorable. And if this is the level of care that we have in this country, well, this country is absolutely finished. Would you let your father out without socks and just open sandals, and he's got a pair of shoes that I supplied, well, I don't know where they've gone, and there's no socks on, and I've got 2 pairs of socks in his case? There's no excuse. Dad, what's happened to your arm? You look as if you've been in a war. I mean, it's just absolutely disgusting. I mean, the state of your arm, look at it. That is absolutely deplorable. As my father has swollen ankles, it takes more time to put his socks on, so I guess the staff couldn't be bothered. Dad has since told me that if it were not for the ambulance driver, he would not have had a hat on his head. Nowadays, there is a mind-numbing array of health and safety rules, risk assessments, etc. The NHS is obsessed with it. To me, all these rules and regulations amount to one thing: common sense deficiency syndrome. I prefer to call it CSDS. Before all this health and safety rubbish started, people used common sense and were responsible for their own actions. Now, providing the correct form has been ticked and the right box has been signed to prove an action was taken, responsibility can be passed to another. So eventually, nobody takes any responsibility because the paperwork says that everything is correct when it isn't. Anyone with an ounce of common sense would realise that a frail, undernourished elderly person wearing sandals without socks in temperatures of -3 degrees could easily catch pneumonia. When my father was first admitted to Chase Farm, Bramley Ward, following his stroke in 2003, the ward had a manager. At that time the staff didn't notice my father had swollen ankles. It had to be pointed out to them. They also put badly soiled washing in bedside lockers. As you can imagine, as the lockers were never washed, the accumulation of previous patients' soiled laundry made them a health hazard. I wrote to the manager regarding this problem. In return, I received the usual non-committal, patronising phone call, and the square root of nothing was done about it. When my mother, who sadly passed away in 2007, was admitted to a different ward in the same hospital on the 15th of December 2006, I was horrified to see the practice of putting soiled laundry into the bedside cabinets was still going on. They also left a badly urine-stained nightdress on the floor from a patient that had a urine infection. A relative visited my mother in the evening. The nightdress had been on the floor since the morning. I was told the stench was so bad you could smell it as soon as you entered the bay. An official complaint proved to be nothing more than a paper shuffling exercise and a complete waste of time. The reply was an insult to the average person's intelligence. In response to the complaint, a badly written notice was put on the door of the bay telling staff not to leave soiled clothing on the floor. The notice disappeared after a few days. The question should have been, Why are we employing people that are that ignorant and slovenly? The action should have been to fire them and get professionals in who know what they're doing. Again, the health and safety system, that's more like a form of brainwashing, deliberately avoids the obvious and allows incompetence to flourish. Because I complained, staff had their spite out on my mother. Mum had lymphedema in her arm. It is essential the affected area is not cut or bruised. As you can see by the cuts and bruises on my mother's arm, the staff couldn't have cared less. It's more like telling a pig not to wallow in the mud. You could put notices around the sty, but the pig will grunt and continue to wallow in the mud as it doesn't know any different. It would appear the common sense deficiency syndrome mentality that left soiled laundry in bedside lockers were of a similar mentality to those that dressed my father when he returned home last Friday. Dad's feet were turning blue with the cold. When Dad went into hospital in mid-December 2008, he weighed 10.5 stone. On numerous occasions, Dad and I were told he would definitely be returning home on a certain day. The day would arrive, and he was still there. This continued to happen. Eventually, Dad got so fed up with having his hopes raised, then let down, that he stopped eating. The nurses were not aware of this, as the food would be served up and later tipped away by the kitchen staff. I continued to tell them about the problem, but as usual, common sense deficiency syndrome was in place. When he got so thin that he could no longer walk, they put a drip on his arm. Dad is now seriously malnourished and doesn't have the strength to stand. Every time Dad has gone into hospital, he has returned home in a worse state of health than when he went in. Admittedly, some things have improved. Some staff are hard-working and polite, but they appear to be working against a tidal wave of bureaucracy. It's much cleaner than it was, and the practice of putting soiled laundry into bedside cabinets has ceased. There is no longer a manager. Instead, there are matrons, but as with any conveyor belt medicine of one size fits all, the patient is nothing more than an overhead that's occupying a bed and is made to feel as such. I'm not going to make an official complaint, as it's a waste of time. It's more like complaining to the SS about cruelty. I'm also fearful of reprisals if my father has to return to hospital again, as he is always admitted to the same ward. I believe it is far more effective to publish this information on the internet. As this has happened to my father, it must be happening to other frail and elderly people throughout the country. The entire NHS system, the entire NHS care system, or lack of it, in England appears to be a part privatised, expensive, multi-tiered, bureaucratic muddle that the pharmaceutical industry makes a fortune out of. As I've already said, complaining to the establishment is a complete waste of time, as nothing changes. The only way we are going to bring about change is by making the masses aware of what is actually going on. Please see our website on allthews, warveteran.co.uk.